Good morning, friends. I am going to talk to you today about the second part of my three-part series, Diagnosis 101, primarily focusing on folks who may have found this channel because they're researching metastatic breast cancer diagnosis, but all of the advice that I'm giving applies to any terminal cancer patient who is about to receive a treatment plan and begin going through chemotherapy or radiation um, or any other treatments to help them through their cancer diagnosis. My hair is freaky today. I tried to do a hairstyle where I combed my curls straight, and I, first of all, I have no idea how to deal with my hair now that it's curly. So today I'm going to go get a haircut that is called a Weedad haircut, which is specifically for curly type hair. And when you see me next, my hair will look different, and hopefully I'll know how to take care of it. But that aside, I wanted to kind of review briefly what I discussed in video 1 of this three-part series, and that was going through the steps of having your testing done, going through your diagnostic appointment with your doctor, finding out what exactly specific to you type of cancer you have. There's the HER positive, there's, the inflammatory breast cancer. There are so many types of cancers and specific to the breast cancer community. And if you have received your diagnosis, you now know what you have, and you've had your testing specific to you, you know where the cancer is in your body, and you have received a treatment plan. At this point, I want to advise you, now that you have reached the point that you know what chemotherapy drugs you're going to be taking, if you're going to be receiving radiation to treat pain or shrink tumors, learn everything you can about the specific drug regimen that you'll be taking. They will probably, your doctor, your chemo center will probably give you what they call chemo training, which is a class and videos specifically explaining the drugs that you will be taking. Learn everything you can from that, but beyond that, also get all the literature you can. You can type into any Google search engine the name of the drug. It will most likely, the top results will show you the drug company's main website. Read on that site not just the patient information that tells you what the side effects are and how to deal with them, but also read the information that specifically is targeted to doctors. It may be hard to read, you may not understand some of the words, but it's really important to not just read the patient information. The doctor information will really give you an education. This is your body. This is you. You're not just studying the drug. You're studying you, because you will be taking this drug. This is now part of your life. Learning this, arming yourself with information and knowledge about how you will be treated in the months to come will make your treatment so much easier. Things will not come out of left field. You'll be looking for these side effects and symptoms that accompany the drug regimen, and you will be more mentally prepared to deal with them. Aside from the treatments, you will be receiving medications to help you through your treatment. Most chemotherapy regimens are accompanied with hair loss, nausea. Some will cause pain, like flu-like pain, aches in your bones, stomach upset, cramps. they will give you, your care team will give you medications to stave off and prevent these side effects from happening. And I cannot strongly enough state this. When they tell you that they're going to be giving you medication for nausea, it's human nature to say, I'm going to wait until I feel yucky and take this medication. No. You can't do that. And your care team will tell you, your nurses will tell you, take this medication whether you need it or not. If the nausea medicine says take every 4 to 6 hours, take that medicine every 4 to 6 hours, whether you feel upset at your stomach or not. And the reason is, if you take the medication every 4 to 6 hours as recommended, it will prevent you from having nausea. It will help you live more comfortably and tolerate the chemotherapy better. You may think, well, I don't know if I need the medicine. Don't wait to find out that you need the medicine. My experience has been that if I don't take the medicine and I wait until I feel the nausea, by that time and I take the medication, I will not be able to keep it down. I will be throwing it up. And once I'm throwing up the medicine, anything I try to take orally won't work. So then I need to either have a suppository, which is not good, or go to the hospital and receive it intravenously. You don't want to keep going to the hospital and having IV medications to prevent nausea. So please take my advice and that of your care team, who will most likely tell you, take it whether you need it or not. In addition to the nausea medicines, you may be given medication to prevent pain. Pain is something so debilitating that if you feel the aches and pains in your bones body-wide, it will flatten you. You don't want to go through this cancer lying on your back waiting for things to end. That can cause depression. And depression is a physical, very real, tangible thing. You don't want to get to that point. Preventing the nausea, preventing the pain, and if they should also give you something to help you sleep at night, take these medicines. You may be saying to yourself, I haven't taken a pill in my life. Now I have to take chemo, nausea medicine, sleeping medication, and something for pain. Really, it is a small price to pay, taking the medications, to be able to live the fullest life you can live while living with cancer. You may note that I say living with cancer. You've been given a diagnosis that you are terminal, and your brain is saying, I'm dying, and you're mentally preparing yourself for that. That's great. Prepare yourself for that. Go to your attorney, prepare your will. Tell the people around you that you love. Tell the people around you that are jerks, you don't want them in your life anymore because you want to live the best life you can. Do what you need to do to get your life in order. But live with cancer. Live with it. Do the things that you want to do. Do the things that you would normally do. If you do the dishes and you feel able to do the dishes, do the dishes. If you can't, ask for help. Even if that's outside of your comfort zone, asking for help, this is the time in your life where you need to try to bend that bit of your personality a bit and ask. Ask for help. This is the time in your life where you can experience growth. Kind of tying into that, a lot of people right now are going to be finding out your diagnosis. And people that you didn't think were your good friends are going to be coming out of the woodwork saying, can I bring dinner? Can I babysit your kids? Can I give you a ride to chemotherapy? Going back to asking you to bend that bit of you that is resistant to accepting help. Try really hard to keep a list of all these people, what they've offered to help you do, and get their phone numbers. Because as you go through the years, and I'm hoping you have years, the years of living with cancer, you're going to realize that all this big well of people that is surrounding you right now offering to help during a crisis time are going to slowly fade to the outskirts of your life. Now, that's not to say that those people won't still be your friends and they won't still be in your life. They will. They just won't be thinking that you need them as much as they see you living a life with terminal cancer. It won't be such a crisis anymore. And they'll realize you actually are living your life and you don't need meals brought every day and you don't need your children picked up or whatever your specific needs are. So at this time where it's really scary and new and you aren't sure what to expect, take all the help that you can get. In addition to all the people that are going to influx into your life that you didn't realize were good friends, you're going to also possibly notice that the people you love and the people who you thought were really dear to you might be freaking out. This is such horrible news to them, and you might notice them pulling away, withdrawing, and some people may even drop out of your life altogether. Right now, you need to focus on you. Accept the help from the people who are offering. Be involved with the people who are actively pursuing involvement in your life, and try very hard to not stress about the people that you notice fading from your life. Of course, keep in touch with them if that's your desire to work that into the relationship. But if you're doing all the work at a time when you should be focusing on yourself, I guess the basic gist of it is, right now you're going to find out who your true friends are. I also want you to realize that everything that you've lived up to this point in your life is normal. It's been normal, it's been your life, it's been what you've experienced, and you think of it as normal. But now you've been told you have terminal cancer, and you have probably been told you're going to be treated for this in one form of medication or another for the rest of your life. The way it was explained to me, and it was really helpful to me, is my husband said, people live with diabetes. They take medication every day. There is no cure for diabetes. There is only treatment. There is no cure for metastatic breast cancer, but there are treatments. There are medicine regimens that you can take that will prevent the cancer from spreading or increasing, and may even diminish it where it's already existing. There is no full-on remission for what you've been diagnosed with. They'll call a lack of sign of disease no evidence of disease, but they will not tell you you are in remission and that you can stop treatment because you have a terminal illness, and they want to continue giving you medicine to prevent anything new from growing or anything from returning where it had previously been. So you will always be on medication. I know that that is just a really bitter pill to swallow. This is the new normal. What you had is gone. This is a new phase in your life. This is the new normal. So become familiar with yourself, your care team, your medications, and as you go through the days in the weeks ahead, it will become a normal routine to you. I want you to focus on the fact that you're not dying. Tomorrow you're not going to wake up dead. Tomorrow you're going to wake up being treated for terminal cancer. What you are is living with a terminal disease. Focus on living with it, and it'll make it so much easier to continue for 10, 15, 20 years with the current technology and medical advancements, you could live a really long, full life and have years and years and years ahead of you. Nobody knows. But you know that you have this day, and I pray that you live it to its fullest. I've covered being proactive with your medications and accepting help, getting to know your medical team and asking them lots and lots of questions. In the previous video, I encouraged you to take as many classes as your cancer center offers through the American Cancer Society and any other nonprofit group that offers care or informative clinics. Take advantage of the freebies that are out there for cancer patients. You can receive chemo caps. You can receive scarves. You can receive even a free wig through the American Cancer Society. There are a lot of things that you can receive that you need and may not be able to afford, depending on what your insurance covers. The most basic things that I can offer as advice right now, and it's very simple, and I would tell anybody well or unwell to do these things. Stay hydrated, use sunscreen, and get plenty of rest. You may or may not feel like eating, depending on, how your chemotherapy and you react to your chemotherapy. So eat what you can, eat what you like, and eat what you're able to. Many small meals spread out over the day are easier to tolerate than 3 big meals. So that pretty much covers what I wanted to discuss with you in this section of this video. I'm noting that most of these videos are running about 17 minutes long. I hope that the information inside isn't too overwhelming. I'm trying to keep it in little bite-sized chunks so that it's easier to digest. Thank you so much for stopping by this vlog. I hope the information that you found here was helpful in some way, shape, or form. If you have any questions, suggestions, or opinions about this vlog, please post them in the comments below. Take a moment to thumbs up. It looks like this video if you found anything at all helpful, and if you'd like to continue seeing more of these videos in the future. If you're finding this on Leslie's Cancer Confessions, take a moment to like, follow, or subscribe. Thank you for stopping by. Take care. Bye, people.